Good evening. Today's June 1st, and today I'll continue to talk about the coronavirus. So the first piece of news that I'd like to talk about is that there are mass protests against police brutality and racism currently in dozens of cities across the United States, also including the Bay Area where I live. This has prompted officials and public health experts to warn of a possible second wave of coronavirus outbreaks. Even though many protesters have taken precautions like wearing masks and trying to stay socially distanced, gatherings of thousands of people will inescapably carry risk. Shouting, panting, and yelling slogans can accelerate the production of respiratory droplets which transmit the virus. The aggressive police response is also contributing to the outbreaks and increasing transmissions because tear gas and pepper spray provoke secretions from the eyes, nose, and mouth and induce coughing, which will inevitably spread these droplets, and a cough could spread thousands or millions of droplets at a time. Dueling protesters can also expand the potential for the virus to spread. And this protest comes as many areas of the country are still experiencing the most lethal days of the pandemic. While coronavirus cases have been dropping, cases are trending upward in Minnesota, where the protests began, and in Wisconsin and the Midwest. While the demonstrations were ignited by the death of George Floyd last week, they're also channeling the outrage felt those who have seen the virus lay bare entrenched inequalities, disproportionately killing Black Americans at a higher rate than whites, and stripping Black Americans of their jobs and income at an outsized rate. So at this point, I feel like protesters should just wear masks, try to stay safe, because the virus could be extremely lethal to them. The second thing that I'd like to talk about is that Julia Marcus, who is an epidemiologist at Harvard Medical School, began speaking out as to the shaming of people going to public parks. So this will inevitably remind people of the AIDS crisis, in which gay men were shamed of having sex, as having gay sex will increase the chance of HIV. So I think this is a very interesting thing, in that as we shutter people in their houses for months, they can't remain in their houses for months, and just like some gay men won't stop having sex. The key instead, I think, is something called harm reduction approach. So the harm reduction approach is basically helping people understand how to reduce the risk of contracting the virus by meeting up with a few friends in a public park but keeping their masks on. So if shaming keeps them from doing so, they may instead meet indoors, which is much more dangerous as the virus will spread faster indoors. So I think the harm reduction approach has share the same goal of reducing illness and death, in that as we stop people from trying to hide themselves and perhaps go into more dangerous areas, we're giving them more space to just instead meet in areas. And so I feel like people just yelling at runners and cyclists and exercisers to wear masks is also the same thing, that runners are experiencing difficulty if they're gonna wear a mask while exercising, and I feel like it's outside, the risk should be lower. So it's just let's just not yell at people, because you could force them to do more things. The third thing that I'd like to talk about is that there have been excessive deaths during the COVID-19 pandemic, and while COVID-19 makes up more than 60% of excess deaths according to the CDC, and the more than 44,000 deaths above normal from mid-March to May in the state of New York and New Jersey, still there are more deaths that have been caused by conditions that are common comorbidities with COVID-19, including the three times as much as the death rate than normal from heart disease and from diabetes, and an epidemiologist said that they could be a group of these who are potentially undiagnosed COVID-19 patients. It is also possible that some patients with these chronic illnesses like heart disease are choosing to stay home rather than risk exposure to the coronavirus by going to the hospital. Some respiratory illnesses that were COVID-19 could have been misdiagnosed as well, and deaths from the flu, pneumonia, and other respiratory diseases may have also been miscategorized as COVID-19, especially earlier during the pandemic when coronavirus tests were harder to get. The CDC data shows flu deaths peaking much later than normal this season. Usually the peak is January or February. This year that's attributed to the flu spike in March and April. So this might be, so maybe people were just mistaking other respiratory diseases as the coronavirus. More older people died of Alzheimer's disease than normal as well. And there was a 60% above normal during the same time period. So I think it could be just that the care for people with Alzheimer's is being complicated by the pandemic, particularly given that this has ripped through certain nursing homes. And deaths from other causes, including Parkinson's disease, dementia, and coronaviruses other than COVID-19, are more than 25% above normal for this time. So that's a pending investigation also included here, and just overall we have seen a spike in almost every illness, including the COVID-19. So it just shows how the pandemic has not only ravaged COVID-19 patients but other patients as well. That's it. Thank you for listening, and I hope you have a good day. Thank you.